Hey everyone, it is Kevin Henry, the editor-in-chief for DrBicuspid. Thrilled to bring you another episode of the Cellerant CEO podcast series, which is powered by DrBicuspid. And today we're going to be talking to Dr. Amreesh Khanna, who is the founder and CEO of OraQ. Dr. Khanna, how are you today?
Good. How are you doing, Kevin? And thank you so much for the opportunity to be on your podcast. Really appreciate it.
Oh my gosh, absolutely. I'm glad to have you on today. I know you're a dentist as well as a business owner. So I really want to get into that entrepreneur mindset with you today, and I'm looking forward to our conversation. But would you just take a moment and maybe introduce what OraQ is before we even get started?
Yeah, sure. And I can just give a quick background on myself as well too.
Please.
And yeah, excited to jump into that entrepreneur mindset, which is core to what we have to do, right?
Awesome.
So I'm a dentist. I've been practicing for over 17 years from Canada and Calgary, Canada specifically. Did my training at the University of Alberta and a residency out at the Montefiore Medical Center, Albert Einstein College of Medicine in New York. So spent many of my years in complex care, surgery, sedation, implants. That was a big part of my clinical practice. Co-own 2 locations. I have a family of dentists, my wife and my brother as well too. And so, yeah, that's who I am on the dentistry side of things, and pivoted into this world of a technology startup here in the past couple of years with our company that I founded called OraQ.ai. And really, how can we drive precision care holistically for our patients, guide optimal, confident treatment planning amongst all of our practitioners, whether it be assistants, hygienists, and doctors, and ultimately drive patient engagement to increase case acceptance, right? If we can get, butts in the seats, as we call it, we're growing our businesses. And if we can do it the right way, hey, like now we can feel confident and feel that we're ethically doing the right thing. And all those things, I think, feed practice growth tremendously.
And when we go to your site, I mean, obviously looked around a little bit in preparation for today. One of the things that struck me, I should say, is that you talk about advancing total patient care. And I'm wondering, what does total patient care mean in your mindset?
Yeah, great question. And, I'll give an example of kind of what spurred me into that whole aspect of being core to our solution. Is that, dentists and practice owners and everybody in a dental practice ecosystem are busy, right? There's so many patients coming in and out the door. What we do is not easy. You're dealing with a stressful, screaming patient or a difficult procedure, and then you're jumping into a recall, and then you're dealing with a staff member that maybe called in sick today and bills to pay. So there's so many things running through our head all the time. So when it comes to evaluating a patient thoroughly, we all bring a certain lens, as I call it, to that experience, right? And we've got, some of us look at the patients in a certain way where we have certain areas of interest. So, for example, a doc that's really into Invisalign, we're going to be kind of looking and mining for those ortho patients, right? And, I'm into implants, so I'm looking for the surgery patients and so on. So whatever has come our way along our practice journey or has guided our CE journey often shapes that lens, right? So there's so much more, though, sometimes to that patient that, hey, how can we be experts in everything, right? But, if we could bring the mind and the wisdom of, as I call it, of 1,000 dentists to every patient relationship, regardless of what our areas of interest are or experience level is, are we a new grad? Are we been out for 30 years? Whatever's come that way, now we have the opportunity to look at that patient holistically. And holistic patient care for us is really about a medically integrated system, so oral systemic health connection. How do we understand that integration between medical and dental? And then looking at everything from a full scope, from bite to, sleep apnea, ruling out sleep disordered breathing, perio, caries, all these different things. We have 7 AI models in our system. So we look at medical risk, sleep disordered breathing risk, occlusion, TMD, ortho, biomechanics, looking for cracks and wear in teeth, caries, perio, and aesthetics. So that's a lot, right? And how do we do that if I just got out of school, or if maybe my practice has been very catered to one type of treatment or something? Hey, well, I might be overlooking certain things just because it hasn't come my way, right? It's not on my radar. So if we can put that in the forefront on the radar, flag our clinical teams, whether they do that type of treatment or not is out of the question now. So we don't worry about that. It's really about now, how do we bring it to their forefront of their discussion and make sure it's a part of that that treatment planning conversation, and the patients being aware of it all.
And whenever I think a lot of people think of AI in dentistry, we've already been thinking about the insurance, the radiology side of AI, but I know you all are taking such a different slant at it, and I love that you all are bringing a different view of this amazing technology into dentistry.
Yeah, totally. I mean, dentistry and AI today is largely imaging AI, like X-ray analysis, right? And we're going far beyond that and looking at everything outside of the imaging. I think the imaging companies are doing some amazing things, and I'm saying, hey, let's look at everything else because we can't predict sleep disordered breathing, a crack, a wear pattern, recession, all those types of things, and putting it all together with a medical history and patient telling me they've got a sore muscle here and a click there. You can't see that off of images, right? So how do we look at all of the rest of that? And that's what OraQ is all catered around. And one of our big differentiators too is we're looking at patient engagement all the way through the entire journey. So from before the patient comes in the door, through a dental exam, an OraQ dental exam, that's what we're really focused on, to even after they've left the operatory, help them understand what we call our OraQ wellness profile, see these areas of risk and really change the conversation that patients tell us often that, hey, you know what? One dentist told me one thing, another dentist told me something else. Who do I believe? Do I need this now? Can I wait? Can I watch? That's the problem that we want to solve. Because if we can solve it at empowering the dental teams to effectively, confidently have those conversations, but then the patient know and leave being like, okay, I get this now, right? I can make my decision in an informed format. So that's where OraQ really plays.
And I'm glad you mentioned the team aspect because I feel like that whenever I look at what OraQ is, it feels like that it's something that the dentist obviously has to grasp, but the team members are going to have so many touch points along the way as well to really make this a successful venture for the practice and the patient.
You're 100% correct. And through the evolution of our journey from the early days when I had this as an idea and we built out our MVP and tested it, so much of it was bringing the dentist mindset to this platform. We've evolved tremendously through our journey to say it can't be about the dentist. Actually, it's got to be about the team, because the team is who drives this, right? And if I walk into an operatory and my team didn't already start the process, I'm probably not going to do it because I don't have the time to open the software or pick up that scanner or tell them to go get an x-ray now, right? Because they're just trying to get the patient out the door and don't want me making them late, right?
Sure.
And so we've really focused it around a team-driven approach and engaging the team in this. So it's exciting to see that hygienists having conversations about risks and scores on these patients even before the doctors walked in the door, because they're empowered with information now too. And it's again, a different conversation that's ever happened in an operatory before. So team-driven approach is key to where we are today and what continues to guide the usage and adoption of our solution.
And again, this is the Cellerant CEO podcast series powered by DrBicuspid. Talked with Dr. Amreesh Khanna today, the founder and CEO of OraQ.ai. And I am curious, as a dentist and as a business owner, how much of being a dentist influence the genesis of your company?
Yeah, it's huge, because I never thought I would be where I am here today. If you asked me 10 years ago, would I be running a tech startup? I would have no idea what that meant, right? And, I've had a unique journey, and I call it from dental drill to keyboard. It has been my journey, right? And, I've had some interesting things come along my way that really shaped me as an entrepreneur in the dental space and understanding the dental business and looking at it as a business, because, we are trained thoroughly on the clinical aspect of what we do, given very little business training, plopped into a $1 million plus business and given financing for it and all these things and say, okay, now go, right? And we're blessed with the fact that if you do good care for your patients, you're going to have a successful, thriving business, right? We don't have to be the most savvy at the business side of it, because if we do our job properly, we're going to be okay. But sometimes things come, and if you want to really grow and change that business, or looking at the DSO model and things like that too, we have to understand it as a business too. So a key thing that came in my journey that shaped me to really understand the business of dentistry was a year after we bought our first practice in 2012. I had to wake up to a phone call one June morning to say, look out my condo building here in downtown Calgary and see 100-year flood that hit Calgary. And our dental practice was just 4 blocks away. Essentially, I had to go to the practice, seeing, the clinic itself flooding and washing, the chairs, figuratively washing away before your eyes in a sense, right? And trying to save $1 million investment that we just put our money into,
Wow.
and then realize like, what am I going to do now, right? And so an experience that, fortunately, probably 99% of our colleagues have never or never will experience in their lifetime. But we had to go from an existing clinic to kind of a quasi startup, rebuild a temporary location. How do we protect our investment? How do we grow the business now? And, fortunately able to more than double the value within a couple of years and bought a second location thereafter. But it was through that process that I really had to start to educate myself around the business of dentistry and looking at the core aspects to run a business. And I joined a business development network out in Canada called Tech Canada, part of Vistage International, a larger group of, kind of like EO and YPO and those types of groups, to really start to educate myself on it. And when I went there at first, I was like, how can other people running other businesses ever understand what I'm going through, right? I need a dental practice consultant. I need to go to a dental practice management course. And then you realize it doesn't matter. I mean, the core functions of any business are similar, right? And gaining that other perspective and educating myself. So I was able to go through other things. I really dove into, I call myself a data junkie and dental nerd. And I love the financial side of the business. I, did some courses and training and got a financial acumen mastery certificate on understanding the P&L and cash flow statements and balance sheets, and understanding how to look at that aspect of care, really looking at leadership. And, I did an inner MBA program by NYU during the pandemic on, socially conscious leadership. So things like that to really drive myself as an entrepreneur and a leader, and not knowing that any of this would have ever spurred me to where I am today with a tech company, because I have to still learn about a tech company. But I think it speaks to the growth mindset, my personal values that, I always have up behind me, and what shaped into the values of our company as well too, to really, say that if we want to build this, I have to be able to understand the core aspects of this business going forward to create something impactful and great in the community.
And I'm so glad you mentioned the values, because, if you go to OraQ.ai, and we'll have that link in the show notes, your core values are very apparent on your website for your company. And I'm curious, how important is that for you to let others know what your core values are?
It's something very important right from day one. Even when I started this company and there was just, me and say one other individual on my team, my co-founders who were part of this, I wanted to, I created the initial vision and values for the company, right? And then as our company started growing and evolving into something as a real company, I kept engaging the team, because I said, this can't be my values and my vision, right? This has to be our collective values and vision, and engage the team as it grew to say, okay, what do we see as core elements, core values to us that guide our decisions, guide the way we interact with one another, and guide the way we interact with our customers, stakeholders, investors. Because, you'll hear it in all these courses out there. They'll say, well, if you just put your mission and values on a plaque on the wall, they just become something as a plaque on the wall, right? But how do you make sure you're hiring for those values? How do you make sure, again, that every decision we make, are we true to those things? And if we're not true to something, do we need to change it? Do we need to change our behaviors, or are we not resonating with our value, right? And so that's what we do, to really make sure that that's important. And why we put it up on our website too is because we want our customers and, stakeholders to really know that, this is something that's been important to really drive culture and growth. And, I cannot do what I'm doing today without the great people behind me. And the great people behind me have to believe in the vision. They have to resonate with the values. And that's what's going to keep us going in the right direction.
There's so much of what you said today that it sounds like it's a lane for a business owner, an entrepreneur, but the same thing, it's a business owner who's a dentist as well. It sounds like they're very similar paths. Is that how you see it? And has those two paths kind of influenced each other as this company has grown?
Yeah, 100%. One of the frameworks, like I'm a systems and process type person, and I got introduced to this framework called Traction, and it's a book by Gino Wickman, and he's got this entrepreneurial organization system, or EOS as they call it, that it really helps to guide your vision, your values, your 10-year goal, or your BHAG, and your big hairy audacious goal, all the way down to your 3-year and your 1 year, and then working on quarterly rocks to get there, and introduced this back in our dental practices. And we use that as a foundation to help us grow what we were doing in the dental practices. I use that on my education platform today. I use it in my nonprofit called Cause to Smile. And then in OraQ, introduced that right from day one, because that framework, again, set us on a path that allowed us to say, okay, these are core elements to grow a business. And I did it in one business, but it's no different doing it in another, right? And the core functions, roles, responsibilities, accountability, all these things that we need to do to drive a successful business, it just changes based on the product or service, right? And so in as a dentist, I'm selling the treatment that I'm doing, and still, helping ensure that my patients as a customer are getting the value from it. Now the dentist has become my customer in my tech company, right? So I'm fortunate to be able to, of course, understand the depth of dentistry and being a dentist, but also now saying, hey, I had to look at it on the other side. So when I was the dentist being like, I'm too busy here today, I don't have time to meet with that rep. Now I'm the rep in the office saying, can you please meet with me, right? So it's changed perspectives, but yeah, I think a lot of parallels and kind of back and forth between the two.
That's fantastic. I'll ask you a question that I've asked the other CEOs that have been a part of this series, and is that, Cellerant is something that I know kind of is the overarching umbrella for everybody that we bring onto the series. How important is it to have a think tank like that, or some way that you can, talk with other business leaders and kind of grow that mindset?
Yeah, very, very important. I think from day one, I really see like I have to embrace a growth mindset and learn from anyone and everyone I can that's been there in some part of this journey ahead of me, right? Because why should I make the mistakes that maybe they've seen or made themselves? If they can teach me something, I can avoid it, and we're all going to be more successful together, and our users are going to be happier, and everybody's going to see value, right? And so when I got introduced to Dr. Lou Schumann and the Cellerant Group, I mean, it's been an awesome group to be working with there, because they bring so much experience through their journey, seeing what they've been intimately involved in, seeing companies that they've seen what's successful, what doesn't work, and then how to really make sure that we're getting the word out effectively in the dental industry and supporting our users effectively, right? One of the big things that I work very closely with Dr. Lou on now is, well, we have to make sure like we're still an early stage company, but our success is dependent upon our users' success. And if we implement this technology properly, support the adoption effectively, every bit of success we get with each user that comes along the way is going to propel us to the next 20 or the next 50 or the next 100, right? But if we don't do that effectively here, well, how can we ever get there? So learning that side of it and understanding, what works and what doesn't work has been extremely valuable to us.
And I know you mentioned you're an early stage company, and I believe you're still looking for users to kind of come along and to help you kind of grow the company. Is that correct?
Yeah, 100%. So we just hard launched into market here into the end of 2023, regulatory approved from both the FDA and Health Canada. And we launched officially into practices here at the start of the year. So we are rocking and rolling, and in single practices and small groups and DSOs, and also working with larger groups as well too, that see the value in our technology. So we're very much in that stage that we're looking for excited dentists, owners that see the value that our solution can provide to organic growth within their organizations, really driving and supporting optimal treatment planning. We hear that as one of the top three challenges that offices and groups are experiencing today. That how do we get everybody on the same page? We're spending so many man hours on our education and mentoring and all this stuff, but we've got a technology now that can support that. And then if we can get patients to say yes to treatment, hey, our businesses are getting, our practices are filled with our schedules, businesses are growing, and we've got a way to manage clinical metrics in a way that we never did before. So yeah, very much open to continuing the conversation, and anybody that's interested in learning more about our technology, I would love to speak with them and tell them about what we're doing.
Again, the website is OraQ.ai. We'll make sure to have that in the show notes, as well as some more information on Dr. Khanna, so that you can learn a little bit more about who's been our guest today. Dr. Khanna, I really appreciate the time. I've enjoyed the insight into your mindset. Thank you so much.
Thank you very much again, Kevin. Really appreciate the opportunity to be on here on your podcast. And yeah, thank you so much.
Absolutely. And thanks to all of you for listening to this episode of the Cellerant CEO podcast series powered by DrBicuspid. We'll be back real soon with another CEO and more tips that can help your business grow.